Welcome, everyone. We're so pleased you're joining us for this special session of the Gender and Pandemic Preparedness and Response Working Group. We'll wait a few more minutes to get more on the line, and then we'll get started. Again, welcome everyone who's already joined the line. We'll get started in 2 more minutes, just while we wait for others to gather. Thank you. Okay, welcome everyone to this special session of the Gender and Pandemic Preparedness and Response Working Group. We're so pleased you could join us today to discuss how gender has been showing up in the INB process and reflect a bit on the draft pandemic accord that was released earlier this week and how we might show up as an advocacy community together to help make sure that the document is gender transformative and advances the goals and priorities we all have in common. As you know, this group has been convened by Pandemic Action Network and Women in Global Health to help bring the advocacy community together around key global moments that have been happening in 2022 and going into 2023 and 24 to work as a collective voice to insert gender into these processes. So we're really pleased that we have a tangible opportunity through the INB process to come together and align for joint action today. Let me turn over to Becca Reisdorf from Women in Global Health just to say hi from her perspective.
Hi, everyone. I apologize for the informality of my background. I'm actually at the airport right now, traveling back from the World Health Summit. It's so lovely to have you all here, and we're really looking forward to this discussion. I think there's lots to talk about as we see how the draft progresses and has progressed over the past few months and what the draft looks like now. So I really look forward to this discussion, and back to you, Courtney. Thank you.
Thanks, Becca. And we know this is a really busy week for a lot of people, so thank you for making the time to join us. We are recording the meeting today as we do, and it will be shared only with those who have registered for the meeting as a readout. And the people who are eligible to attend these meetings are members of Women in Global Health Network and members of the Pandemic Action Network. So it will be available as a resource to come back to, since this is a busy week with lots of things going on in the broader global health community. We are so pleased to have Dr. Lwazi Manzi with us today. to help provide some reflections on gender in the INB process. Dr. Lwazi is a medical doctor. She is a former spokesperson for the Ministry of Health in South Africa, and she is currently head of the Secretariat for the African Union COVID-19 Commission. Dr. Lwazi, thank you for joining us, and we look forward to hearing your perspectives on how gender has been showing up in the INB process. Over to you.
Thank you so much, and it's lovely to join all of your colleagues in civil society. It's always really amazing to engage civil society because as a doctor, I know that what we really need is the perspectives coming in from the ground, and policy should really be shaped by the lived experience of people and health workers as well, the health workers that look after them. So really my role here is not to provide perspectives, but rather to just say that as the COVID-19 Commission, I'll explain now where we come from. We are here to listen and support in any way that's appropriate and try and ensure that, there is platforms or places for dialogue to be able to actually unpack some of these issues and ensure that they land in the right political arenas expediently. That's really, the role that we see ourselves play, both in the regional and the global sphere. As was introduced, I'm head of Secretariat of the COVID-19 Commission, and that commission supports President Ramaphosa in his role as the champion on COVID-19. But I also play a role in what many of you know as the Johannesburg process, which is a consensus-building exercise for medical countermeasures, and not in any way to preempt or undermine the INB, but once again, to simply provide a platform and a place for discourse so that we can unpack all of these issues that we are very complicated issues that we're trying to land at the INB and other processes, G7, G20, AU in my case, and others, of course, that are very important. Now, on the gender responsiveness, this has become part of the work that we do under the Gender and Stigmatization Working Group of the COVID-19 Commission, where we set up a community of practice for gender and health. And when we launched the community of practice in Egypt ExCon this year, we made it clear that this was a place to come to deal with issues of gender and health and to advise us who are the ones who equally advise those who sit in high political levels on the policies that need to land to ensure that there is adequate expression of rights of women and by extension children, children and adolescents, my apologies. And so this community of practice was born, and we anchored it in a series of webinars. But in the past two webinars, what became clear is that the stakeholders really wanted to deal with the issues of gender responsive PPPR. We're very fortunate to be joined in both webinars, and the last webinar was held on the margins of UNGA by Dr. Precious Motsoso, who, as you know, is the co-chair of the INB. And she very much highlighted that there was still a lot of work to be done in gender responsive policy in general, but she was also of the view that more work actually can be done in the INB itself. And she was the one that alerted us that they intend to actually open up the next INB meeting in November to beyond just member states. And so it's really exciting then that we were given this opportunity. You know, we had a meeting with CSOs as Johannesburg process, and Louise was there. And Mike was standing next to me and he said, you know, what we don't appreciate is being told 2 days before that, hey, you know, a process has been opened up to civil society, and then everybody has to come together on the last minute and try and work out the policy language that must land. So I'm really, really glad that our platform was the one that actually gave us an opportunity to alert civil society that, you know, there is actually an upcoming meeting that will be open. And therefore, there's an opportunity to actually deal with gender responsive language. So really, colleagues, I just want to say from our perspective as COVID-19 Commission, community of practice, that you know, we are here to support, we're here to listen. We share many of the concerns that I know that you have in regards to gender responsiveness. My perspective, just and this is just, let me just say personally, me from where I sit, is that the language, whilst it's great that it's inclusive, I'm not quite sure that it's actually gender responsive. So I think we need to ensure that this language is actually going to express or lead to an expression of gender responsiveness. Rather than just saying, you know, let's ensure that women, children, and adolescents are included in all of our plans. I don't think that's going to really cut it if ever we are faced with another pandemic of COVID-19 proportions. So with that said, thank you so much, colleagues. I'm not going to say much, but I might pop some things into the chat. If anybody has any questions for me, I'll be here, happy to answer if any questions are directed to me. But I really, really look forward to hearing this conversation and hearing everybody else's perspectives. Thanks a lot.
Thank you, Dr. Lwazi. It's great to hear about the work you've been doing with the AU COVID-19 Commission and also the community of practice, especially alongside UNGA, and the conversation with Dr. Precious about opening the next INB session in November to more stakeholders and the opportunity to push for stronger gender provisions in the Pandemic Accord draft. That's what we're here to discuss today, and we look forward to this being a good joint brainstorming session where we can discuss priorities and then come back with more ideas on how we can work together to elevate these priorities during the INB process in early November. So I just wanted to touch quickly on the priorities that this group had already identified in terms of promoting gender responsive policies for pandemic PPR. And those have been requiring gender balance, at least 50% women in PPR governance and decision-making, establishing systems to protect against sexual exploitation, abuse, and harassment, and gender-based violence, advancing fit-for-purpose PPE, acknowledging that a lot of mass market PPE is not fit or designed for women's bodies, guaranteeing social and occupational protection, as well as fair and equal remuneration for health workers, especially community health workers who are often not counted among the formal labor force. Maintaining essential health services during a pandemic and making sure that maternal and neonatal and child health, as well as sexual and reproductive health services, are included in the definition of essential health services. And also promoting gender disaggregated data so that when we're assessing progress or implementation of pandemic PPR reforms, we're getting the broadest picture possible of how these policies and programs are impacting different populations on the ground. So those are some of the priorities that this group has already collectively identified. And one of the steps that we've taken is to take a look at the Pandemic Accord draft and see how some of those priorities shook out in the document. I know that the document isn't publicly available yet, but what we can do is display some excerpts from that document and talk through together what's in there and where we may need to collectively push to see more progress on the priorities we've already identified, but other priorities that might be important for this group. Can everyone see the document displayed?
Yes.
Thank you. So looking at the text that was released on Monday, we've done a quick analysis of where gender shows up in the draft negotiating text. And also a little bit of sort of where it could be stronger. You'll see here in Article 1, there's a definition of persons in vulnerable situations, and it gives some descriptions about what a person in a vulnerable situation might be, and it talks about discrimination on the basis of race, color, sex, language, religion, political, or other option. I think here we could push for a stronger language that includes gender versus a sex disaggregation. We also see gender show up in the Article 7 on health and care workforce, talking about addressing gender and youth disparities, and supporting meaningful representation, engagement, participation, empowerment, and safety and well-being of all health and care workers while addressing discrimination, stigma, inequality, and eliminating bias, including unequal remuneration, and noting that women still often face significant barriers to reaching leadership and decision-making roles. Gender also shows up in Article 9 on research and development, noting that parties shall ensure that clinical trials have equitable representation, considering racial, ethnic, and gender diversity. Lastly, gender shows up in Article 16 on international collaboration and cooperation, discussing that parties shall collaborate and cooperate with international and intergovernmental organizations and other bodies to promote equitable representation on the basis of gender and other stratifiers. If we go back to the priorities that we had discussed together, some things that are not missing are any mentions of sexual exploitation and violence against women. There is some language on protecting violence against the health workforce. There is no language on personal protective equipment. There is no reference to a definition of essential health services, and certainly not essential health services that specifically call out MNCH or SRH. And there's not a discussion on disaggregated data at any level. And as Dr. Loisy highlighted from her perspective, a lot of the mentions of gender in the document are about inclusion, not necessarily anything that is gender responsive or gender transformative. So with that, I will stop sharing my screen and open it up to the group for your thoughts and reflections on gender in the Pandemic Accord draft, in the INB process so far, and just broader thoughts on how we need to show up to advance a more gender responsive INB process. Serena, I see your hand up. Others, please raise your hand and we will open the floor.
Hi, thank you, Courtney. Thanks, everybody. I'm joined today, the advocacy chair for the G4 Alliance, and Natalie Sheneman is our advocacy manager. So I'm really excited to be here. One thing that I wanted to sort of include, because our organization focuses on neglected surgical patients and really advocating for access to safe, affordable, and high quality surgery, obstetric, trauma, anesthesia care, and also perioperative care. So I noted that the maternal priorities and the sexual reproductive health priorities are really, they're there. But what would be important is if the workforce component could sort of be a little bit more sensitive to the fact that those kinds of conditions can have a surgical component. And what we realized during the pandemic was that OTs came to a halt because they needed the space for critical care. And so surgeons of any sort of cutting division were sort of this laid to rest workforce. And it would be ideal if that sort of, I don't know how the language would be, but there's the necessity to make sure that that workforce is conceived of when we talk about maternal, these gendered components to health, right? So that there is space for and attention to the surgical hands that are involved in saving during delivery, saving lives during delivery.
Thank you, Serena. Points noted on the varied aspect of what maternal and child health looks like and the surgical components of that to make sure that they are also upheld and protected during times of health crises. I'd love to hear from others on your perspective on the process so far, on what priorities in PPR policy should be. Claire?
Hi, thanks everyone. Thanks to Loisy for that introduction, and to Women in Global Health and PAN for hosting this. I guess my challenge, right, is that you can't just look at this in this one location, right? In that you can't just look at the mentions of gender and women. You've got to consider the broader debates and politics that's happening that's going to determine the outcome of the gender inclusion, right? Which is that, you know, if you look at Article 2 of it, right, and it's all about protecting, you know, with equity as a guiding principle, protecting, you know, preventing, prepare for, and responding to pandemics. But equity, which is this guiding principle, are highlighted in Article 2, the objective and scope, so what the treaty is going to be able to do. Equity is defined purely in terms of access to medicines, right? So the narrow definition of equity in Article 3 and how that's then used for the purpose and scope limits a lot of what's going to happen with gender, right? And so really, like, and this is a fundamental tension with this whole instrument, which is this whole instrument basically is about access to medicines, and everything else is, you know, a side step. And as unfortunate as that is, I think honestly that's my crude opinion of what's going on here. And so I just wonder how, you know, I just think you've got to think about the bigger picture before we narrow in on the kind of smaller areas where we see it. And then I think we've also got to be really careful because, you know, the areas that you've picked up on that are in the text that are related to gender or women is quite narrow in terms of gender, as in it's just women, right? And I think the reference to sex shows that there's obviously pressures from conservative states that it's only about women. But, you know, and this goes back to what Loazi was saying, right? Like, it's not gender responsive at the moment, right? But then, and I say this with the best respect to the people in this call and your organizations, the asks that you had weren't necessarily transformative, right? You were asking about representation and, you know, healthcare workers, fair enumeration. I'm not suggesting that's not important, but it's all layered, right? And I really think that you have to deal with that first point to allow the scope for more transformative action throughout it.
Thank you, Claire. Those are important points. And I'll note that while I am newer to following the pandemic accord process, I understand that between the last draft being released and this draft, that the document has been pretty fundamentally reshaped in terms of structure and content. So it is interesting also to watch the trajectory of the INB process and see how the document has been sort of winnowed down and focused in certain areas. Because as you said, yep, go ahead.
I was going to say absolutely, but gender has been weakened at every stage as well, right? And to me, that's because there's not scope for it in terms of what else is going on, and I think it's seen as like a lesser important thing. Now, I'm not suggesting that's my belief, but I think it's, you know, fundamental. But I think that we have to be savvy to the politics that's going on here, right? And what the big debates are. And then how can you attach gender within those bigger debates?
So if the bigger debates are around access to medical countermeasures, and we see in the text that has come out so far that vulnerable populations only has a definition that disaggregates by sex, not broader gender, it would be great to talk collectively about what do we do with an instrument that's focused on access to medicine, where some of the definitions that guide an equitable approach to access don't include a fuller perspective of gender. Stella, I see your hand. Please come in.
Hi, everyone. I'm so sorry I'm in Uganda and my network is very bad. My name is Dr. Stella Busire. I'm the founding executive director of the Africa Center for Health Systems and Gender Justice. I really want to just resonate with Claire, what she said about the narrow lens around which we are looking at gender, because I thought perhaps one of the reasons why we are having a more deliberate thought around the pandemic response from a gendered lens is for us to be more inclusive. and not just an inclusivity from a place of just definition of the expansiveness of gender, but also to unpack what really the different vulnerabilities that come in when it comes to pandemic response, and this, of course, lessons having learned during COVID. And I speak this first as a medical doctor and a lawyer, and I say that biomedical interventions, and that's why I agree that this document is very weak, because it still takes a biomedical lens without an expansiveness on the social issues that come during a pandemic. For instance, when you look about, when you think about access to contraceptives, access to antenatal care, social nets around protection of vulnerable people within the community, if it's sexual and gender minority person, if it's the elderly, if it's young girls who we saw what happened, if it's the issues of gender-based violence. I think that's something very important that we need to be able to critically bring out, because if there's any lesson that we actually learned during COVID, is that the vaccines and the medicines were not the only solutions, that we needed to be able to think about the social determinants of health broadly and to situate them in the pandemic response. And until we did that, until we are able to think about poor communities who could not even afford daily meals, until we were able to think about communities that had to walk long distances to access clean water, until we had to think about communities who dependent on a daily source of income because they are casual laborers, then the response from the public actually weakened, because people had to make a decision. And so I think for us collectively here, we have the power to nuance those, to bring those nuances which would not obviously be brought if we just went in from an accessibility in terms of medicine's perspective. And I think we have an opportunity to be able to broaden that conversation. We have an opportunity to be able to push back, and we should be able to do that. Thank you.
Thank you very much for those comments. And I see in the chat that others are agreeing with you that the draft accord does not look at broader issues of protection and essential social services. And that also there's an opportunity to push back on the scope of the INB process and the draft accord to make sure that it's truly the instrument that was sought at the beginning of this process, not necessarily a narrow instrument on access to medicines, that there are more dimensions that are important to align the international community on. Are there other perspectives to share? Eloise?
Hi, so just thinking about how gender and reference to vulnerable populations and people shows up. I'm just thinking about the sort of broader issues of gender sensitive areas, getting into like social security and some of the whole of society issues that we think about when we think about pandemic preparedness, and what a treaty could do in terms of offering some guidance for countries and some minimum standards, if you like. And I'm just wondering if there's a way to think about that's rooted in appropriate international law that cites some references that are helpful without seeking to do the impossible, which is to set social security standards for every country in the world. So just thinking about, there's the obvious issues that lead to the insertion of the words gender and women, and then there's the ones that are a little bit more tangential, and how much should we go into those? And obviously that's a bit of capacity dependence, etc. But if we were to prioritize some of those areas, what would they be? And what would be appropriate for a pandemic accord? So I'm afraid I'm raising questions rather than solutions or answers, but just wondered if amongst the wisdom here, people had thoughts on any of that. Thank you.
Stella, I see your hand again. Please come in.
Thank you, Sana Eloise, for your questions, because what they do is that they make us really introspect around the opportunity that we have right now to either right or wrong historically around what gender has been presented as, but also to just bring again, and I want to use the example that you've given around what does it look like in terms of international law. And I'm just thinking about one that comes into my mind is CEDAW, you know. And we can actually leverage on CEDAW, we can leverage on the Maputo Protocol within, for instance, for us within the African continent, and within other regional international laws that are very critical. We can also leverage on some of the resolutions that have been passed, particularly when you're looking at the Office of the High Commission of Human Rights around expansiveness of gender. We look at report from the independent expert on sexual and gender minorities, for instance, around inclusion of that. And I say this very cognizant of the fact that it's not, it's still, and again, quoting Claire, that you can feel the spirit of the drafters as being very conservative. And I feel like maybe this is actually an opportunity for us to just, you know, shake ourselves a little bit up, to be able to just have these strong recommendations that we can back up with international law, regional laws, but even national laws within different jurisdictions that have been able to define gender, and also a recognition of the expansiveness of that. But also just even from a feminist level around the nuances around different vulnerabilities and how that show up. Because if you're to expand that, then we're looking at instruments like the International Covenant of Social and Economic Rights, which would actually even give us more teeth into being able to just support some of the arguments that you're having here. But I really like that question, because now it gives it asks us how do we justify this? Where do we move from there? Thank you.
Thank you, Stella. Serena?
Hi, yes. I liked where Stella was going. It got me thinking about an aspect, and no, we're still on gender, but looking at the time, I am interested as well in talking about the definition of essential. And two recent World Health resolutions come to mind, the one on access to medical oxygen and the emergency critical operative. I'll put those, Courtney, in the Zoom chat, so you have the language. In those resolutions, what we have is a deepening of what is expected, not just during a respiratory health crisis, but also for just what should be available in terms of these areas of care, right? And I'm speaking from the operative encounter and the perioperative. My colleague Natalie Sheneman also noted that during the pandemic, the anesthesia workforce was overextended, right? Because most intensive care doctors have an anesthesia training background. So if we're going to look at legislation or treaties that we want to draw from for how to strengthen gender, I think we should do the same when it comes to essential. And I also want to broaden it and say that right now, one of the areas that are happening within global surgery, there's a lot of movement inside South America to try to do more system strengthening that's conducive to the ECHO resolution. And I would say, I know that some of those, and I know within Latin America, Colombia is working on its own national action plan for women, peace, and security. That's an area to draw on. And we do have PAHO, which has had some gender language, so the Pan American Health Organization. So I think what I'm trying to say is, I think it would be nice if we were synthesizing where we're going for gender strengthening language, and also to pair that really nicely with the more recent resolutions that are coming out. Thanks.
Thank you, Serena. And I see in the chat, we have a question from our colleague Nahashan asking how much room there may be for new text proposals as part of the INB process in November. I'm just catching up on the chat to see if anyone had answered that. sort of what is the prognostication for if member states will adopt this current text as is. I would expect that this is just the start of the process, and there will be a lot of suggestions from member states, both to cut and add to the text. But I would appreciate perspectives from others on the call who might have different opinions on the process that's coming forward. And also thank Serena for her comments on thinking about how we can unpack and advance some more context around essential services, leveraging past agreements on what those are. I'll also just note that I probably don't need to note this for people on the call, but you know, there are conservative pressures in lots of different political processes related to gender and health and social protection, and a lot of the political commitments that were made years ago would be pretty hard to achieve consensus on currently, which doesn't mean that we should limit ourselves in terms of the precedent that we refer to, but just acknowledging that if we look at processes that happen around CSW and different moments where gender has the possibility to be elevated and promote sexual and reproductive health and rights for girls, women, and all genders, the pressure is enormous, and there are threats of reversal. So keeping in mind the broader political context is also important, so we think about how we are showing up for success. Natalie?
Hi, everyone, and thank you for that comment about the sort of gender becoming this like sort of target in processes like these and being kind of a sensitive political topic. And I wonder, just to sort of reinforce what everyone else has been saying, and I'm coming at this really new to following the IMB, but I am wondering if maybe the sort of entry point then for gender is through something like essential health services and social protection, because if you can strengthen those aspects, then you are strengthening gender equity and other equity.
Thank you, Natalie. I certainly think that's a part where we can start, but we'll also note Claire's remarks at the beginning, saying that seeing in the definition of vulnerable populations that the word sex is there and not gender shows already that there has been a lot of pushback on more inclusive language, and that's often the default that we come to, which is a very narrow interpretation of what sex and gender mean. Would love to hear perspectives from others, especially on some collective actions or next steps we might like to take as a community heading into the November session. Serena.
Thanks. So one thing that we tend to do is talk about the pregnant person. And I'm just wondering if we can, because gender is being flagged and there is so many, I mean, just in general, it's a target. I'm wondering if our pushback on their pushback is to use the term person, personhood. And in that sense, we're also sort of drawing the human component to the right. So that's what I'm wondering. So the pregnant person, SRHR, needs of people, like, so then, I mean, it's not ideal, but I'm just, and please fight back or argue away so I'm learning.
Stella, please come in again.
Sorry, I hope I'm not occupying too much space. Serena, I really like that question because it's actually a philosophical question, and it's a question that has been very difficult. Hello, can you hear me?
Yes, we can hear you. Thank you.
Yeah, thank you. Yeah, and that question has actually, because what it does is that it neutralizes the polarization around the being that you're trying to define. And I feel like while it does that, but the other thing that it also dehumanizes certain existences, you know, so there's also that. And so for me, the safest place usually is to go is the place of precedence, as Courtney also put it. And the place of precedent is, again, what are the current nomenclatures that exist even from WHO, and WHO has also done some fantastic job around defining that, how it is that we can look at gender. But I also, even as you're getting into this conversation, I'm just wary at the back of my mind of not to pigeon ourselves into this debate that just looks at gender from more of a sexual orientation and perspective, but to expand our thinking to think about, when we talk about gender, what are the other vulnerabilities that we're thinking about, you know? Because when we talk about equity, we're expanding beyond sexuality, and gender is one marginalization. There's also poverty. There's also geographical, you know, there's also there are also communities that are for one reason or the other ones, like who are in conflict, who are refugees. And so we must be able to have all those in mind, so that we don't win this, more or less, I call it a debate around pigeoning ourselves, and then we leave out a very important, a huge component of the population that actually needs us to speak about them. So for instance, if you look at the refugee community and COVID, you know, even in prioritization around vaccination, it was mostly an afterthought after countries were able to take care of their own populations. And you can understand, because most nations wanted to ensure that their citizens were able to get back vaccines. And yet, from a human rights perspective, the right to health is a universal right. And so it doesn't matter your ethnicity, your nationality, your sex. So just sex and gender is just one of the many components. And so I feel like this is actually a very good opportunity for us to use language that has been used to give recommendations on this. And I'm putting myself out here. If you'd want me to just put together a document that what that looks like, I can gladly do that. And then we can perhaps talk about that, discuss among ourselves, even as the November meeting that is coming. But I'm just offering myself out there, but also just putting that caution. Thank you.
Thank you. It's always great to have offers of input and partners on this call leading efforts that we can all support and rally behind. So we would love to work with you collectively on that. Thank you. And this conversation has been making me think about what are our goals around the pandemic accord. And we've been having a discussion here today about leveraging precedent and leveraging pre-existing language to make the pandemic accord stronger. But back to Claire's point at the beginning, that doesn't necessarily push for a document that's gender transformative, that more aligns with making sure there are no gaps, helping to maintain a level of inclusion and not reverse progress that we've had in the past. So it would be interesting to hear from those on the call, noting the scope challenges of the draft, and that it is not currently a document that's talking about all the different steps that parties must do in the onset of a pandemic, but more focused on access to countermeasures. Are we looking to pursue something that's truly gender transformative? And then what do we need to do? Versus, are we looking to keep gender as central as we can, or are we just looking at the political realities of what's possible? Perhaps too big a question.
Sorry, just one thing. So I think one thing that might be, sorry, my video's off. One thing that might be useful to think about is that in the previous version, or it might have been 2 versions ago, there was a guiding principle around gender. And so that then determines the process for the rest of the whole treaty. but that's been removed. And you know, in previous versions, they had words like gender transformative and gender responsive put in brackets that clearly have been taken out so far through the process. But I mean, you know, pushing for something in a preamble or a guiding principle then means that it applies, or, you know, it's to be used and considered across the whole document rather than having its own article, or rather than being mentioned in smaller parts. So that could be a tangible ask, right? Like you had it previously, and it then means that it's across all the location.
Thank you, Claire. I appreciate that very tangible suggestion. Nahashan and then Laura.
Thanks, Courtney. Can you hear me?
Yes, I can.
Courtney, thanks. I'm Nahashan Alwaka. I'm with the Pandemic Action Network, and I've been following the INB process a bit more. And I know these are very important discussions. And you know, at the back of my mind, I'm thinking probably we needed to have this gender working group right from the start, but you know, this is the best time when we started. But again, a lot of water has gone under the bridge. We just didn't land with a negotiating text yesterday from nowhere. It has been a very protracted process, and I know we've seen the you know, the zero draft. We've seen the bureau's text. You know, and many other processes. There were submissions that were being made at some process, but I think for some reason there was not much deliberate thinking about gender as we are doing in this call. So probably that was a lost opportunity in quotes. But here we are, great minds, you know, raising great questions. What opportunities do we have? I mean, the INB process keeps rolling, and the deadline is nearing. And I think the 7th INB, which is coming up, is an opportunity if we get, you know, to put together comments that we can submit. I know the priority is normally given to member states, and they will give them and all that, and then towards the end, there's an opportunity for relevance. Those who you know, are registered and are considered relevant stakeholder and may have an opportunity to make a comment on behalf of the group. And I think it is important to make the strong point on the need to strengthen gender elements in the draft text. So it's not like we have lost everything. There's still an opportunity to mention the right things, give very short, crisp, clear messages, and I think that may be help. But again, we also have opportunity to engage directly with member states who are part of the you know, drafting group. Relevant stakeholders, we don't have that opportunity. So there's strong member states who are leading different, you know, what they call the informal sessions, for instance, where a lot of discussion is happening. And I think if we have those strategic, influential voices in those spaces, that may help. So I think at the end, when we think about how we want to go forward, it will be great to consider the opportunities that the upcoming 7th INB accords us, but also the other, you know, engagements that we can do with member states who are taking direct role in the negotiations. Thanks, Courtney.
Thanks, Nahashan. That was really helpful to hear the perspective on different opportunities. You know, one that we as stakeholders can take through limited access at the INB session in November, but also working with supportive member states who certainly do have more direct influence over the process. Laura, to you.
Hi, thank you. I'm gonna leave my camera off because it's quite early here. I was more picking up on a point that was asked earlier throughout the process on introducing entirely new text. I am new to the overall space, but having seen previous iteration, we are seeing the lowest common denominator of what countries could agree on. And I think we'd be more successful amending or editing, suggesting new additions to what is already in the text rather than entirely new excerpts of texts. That being said, on Claire's suggestion with a gender as a guiding principle, I love it. I'd love for it to stay in there. But I also know that there were previous discussions on too many guiding principles sort of watering down the meaning of the word principle. So if we just suddenly have 20 guiding principles to adhere by, where do we start? Where do we stop? And whether it might be, I don't know. So that's maybe also a question back to Claire. If it's more productive to tackle the guiding principles of equity, for example, and make it more gender inclusive, or if really adding a new gender principle would still be productive, as in that it wouldn't water down and wouldn't just be adding another one to the list and just having it there as like this token principle, so to say. That is maybe just a question back rather than a productive input myself.
Thank you. That's important perspective to have. And it does seem that the document is being, whittled to lowest common denominators, and there's still tension on what those lowest common denominators are. The timeline for the INB process was always ambitious, and having a process that, in theory is to wrap in May of next year was always going to be hard. And it seems to many that that timeline will not be met. So I think there's also the question of what really is the timeline for this, and what does that mean opportunities are. Sabrina, to you.
I think Lara's hand was up. Is that an old hand or?
Sorry, just the old hand. Go ahead.
Okay, sure. So I just got back late Tuesday night from Berlin for the Health Summit, and one of the really exciting things that came out was the COP28 presidency. United Arab Emirates had like the morning of gave this big announcement that they want to have a closed door, high level ministerial meeting to talk about climate and health. And this is the first time in the history of the COPs, since it started in 1995, that there's going to be a day dedicated to health. And one activity we could do leading up to that day, which is December 3rd, Courtney, I'll put it in the chat, is start to engage the ministers of health, and the other two that are also being invited are finance and environment. And this is for all 194 members of the World Health Assembly. So this is a massive opportunity for us to push our health agenda in a climate space where there is a ton of money and a ton of resources and a ton of negotiating around things that are unrelated. So I would say that this could be something that maybe we do in a smaller subcommittee. I have time. I'm happy to work with Stella. Anybody else who wants to put together talking points that could be circulated to ministers of health prior to that date, December 3rd.
Thank you for highlighting the emerging climate and health opportunity. I know at Pandemic Action Network, we see this as a really strategic way to make sure we're linking to the whole of society, global aspects of what helps keep us prepared and preventing pandemics. And it is a good opportunity to make the vital links between gender and health elevated with health ministers. So thank you for that. I see we just have a few minutes left, and this has been a good conversation, but potentially with more questions than answers about where we go from here and what's the most strategic opportunities for the INB meeting in November. So reflections from me as we close out is I look forward to going over the notes of this meeting to really refresh myself on the points that everyone brought up, but also thinking about how we weigh our political opportunities in terms of the practical direction of where this pandemic accord draft might go, and finding strategic opportunities, whether that's going big or focusing on precedent. And I look forward to hearing more from those on the call and those who couldn't be present. So I think we as a working group can commit to coming back with more ideas and working collectively. And thank you to Stella and Serena, who have offered to take the leads on other streams of work so that we can all work together for common cause. Becca, would you like to come in with any closing reflections?
Thanks, Courtney. And I think I'll leave my camera off this time. I've got not such a formal background. Just want to thank everyone for joining today. It's been really insightful to hear from you all. And I was the one taking notes, and I took down some very concrete action items that I think we can take forward. So we will follow up with those and just ensure that we work the most efficient way possible as the timeline is short. But I do think that there's definitely opportunities, and there were some really good ideas that came up as to how we can ensure that the draft gets strengthened a little bit more on the gender side. And I also really take the point around other vulnerabilities and the point around intersectionality. I think that that's really important. So just wanted to say thank you again, and please do stay tuned for those follow-up notes and for any follow-up activities that we'll be doing. Thanks, Courtney.
Thanks, Becca. And just to highlight here, some of the concrete ideas that had come forward in this meeting were looking at past preamble text and how we might want to reinsert a gender principle, thinking about whether it might make strategic sense to focus on an equity preamble and look at the text that's there and how to make gender stronger in that. Making sure we're all familiar with past precedent on gender and SRH and essential services so that we can leverage pre-existing global commitments to help make this draft accord stronger. And then really considering what is the scope and ambition for this pandemic accord. Is it narrowly on access to medicines, or is there room to make it broader for the equity and services and steps that countries need to take in the onset of a pandemic? So thank you for this thought-provoking discussion. Conversations around gender and health and PPR are always complex, and there's a multitude of ways that we can collectively work together on this. And so appreciate the participation and input today. We look forward to staying in touch, and thanks again. Have a great rest of your week. And thank you so much to Dr. Loazi for joining us today. It is great to have you on the call and hear the work you're doing and your perspectives.
Thank you and
Thanks,
goodbye.
Thanks, Courtney. Thanks, Dr. Loazi. Bye.